Hello everyone and good afternoon. How many people in here have seen an attractive person with almost perfect everything? Beautiful skin, nice body, perfect features, etc. And wondering yourselves if that person's body is the result of exercise and good nutrition? Well, today I will inform you about the plastic surgery phenomenon, its early beginnings, and its current growth. By nature, women more than men always look for ways in which we can improve our appearance, and I consider myself one of them. After doing an extensive research on the subject, I believe I have enough information to educate you about this phenomenon. First, I will begin by telling you a little bit about the history of plastic surgery and its development. Second, I will go through the specialties of plastic surgery and the statistics, and third, I will go through the pros and cons of plastic surgery. Let's go back to the past to find out how plastic surgery was born. There are many interesting facts immersed in the history of plastic surgery. Plastic surgery derives its name from the Greek plastikos, meaning to mold or to give form, and the specialty is divided into reconstructive and cosmetic surgery, which I'll explain later. Around the 1st century BC, Roman physicians practiced early beginnings of surgical methods to alter the body. They would operate on former gladiators whose bodies and faces had become severely damaged. It was during this period that Roman medical writer Aulus Cornelius Celsus wrote the Medicina, which laid out surgical methods for reconstructing ears, lips, and noses. 100 years later, India and Egypt would start using plastic surgery as well. According to an article written for the Washington Post by historian Thomas A. Bacco, Asian physicians from these countries employ this practice in instances of battle wounds or animal attacks, where they will use wine as anesthesia and the use of leeches to keep wound free of blood clots. Among their contributions, the reconstruction of the nose, also known as rhinoplastia, as well as the use of cheek flaps to resist absent earlobes, were the common ones. Going back to the Romans and after the fall of Rome at the end of the 3rd century AD, the progress of plastic surgery appeared to have stalled for several hundred years. The spread of Christianity forbade any kind of surgical changes to the body because surgery ran the risk of inflicting death upon patients, and what's more, it was suggestive of sorcery. The procedure was revived in Europe until around the time Christopher Columbus set sail in 1492, when Italian surgeons used skin from both the cheek and arm to replace noses. The outbreak of World War I changed the course of plastic surgery history forever. The need to treat extensive facial and head injuries caused by modern weaponry made brave new innovations in reconstructive surgical procedures possible. This resulted in plastic surgery quickly becoming an independent medical practice. In order to regulate the profession, the American Society of Plastic Surgeons was created in 1931, and with the establishment of an authoritative institution, plastic surgery began a new age of enlightenment and innovation. Now that I have explained a little bit about the history and development of plastic surgery, let's go briefly through the specialties of plastic surgery and the statistics. As mentioned before, plastic surgery is divided into reconstructive and cosmetic surgery. According to the American Society of Plastic Surgeons, reconstructive surgery is performed on abnormal structures of the body caused by congenital defects, developmental abnormalities, tumors, or disease. In 1998, President Bill Clinton signed the Women's Health and Cancer Rights Act, a law requiring insurance companies to cover breast reconstruction surgeries after a mastectomy or the removal of a breast due to breast cancer. Cosmetic surgery, on the other hand, is performed to improve the person's appearance and self-esteem. A few examples would be breast augmentation, dermal fillers, tummy tuck, button augmentation, skin rejuvenation, and Botox. Compared to reconstructive surgery, this type of surgery is usually not covered by health insurance. Within the past 100 years, the field of plastic surgery has experienced tremendous progress. In response to the rapid growth of plastic surgery, the American Society of Plastic Surgeons eventually changed its title to its present name, the American Board of Plastic Surgery. In the mid-2000s, interest in plastic surgery skyrocketed. Popular shows such as Extreme Makeover, Dr. 9210, and Nip Tuck gave the plastic surgery industry a new familiar look to the public. According to annual plastic surgery procedural statistics, the American Society of Plastic Surgeons reported that 15.1 million cosmetic surgery procedures were performed in the United States in 2013, up to 3% since 2012, and being Botox and facial fillers the most popular treatments, and 5.7 million reconstructive surgery procedures. Now that I have explained what the specialties of plastic surgeries are and their statistics, let's find out what the pros and cons of plastic surgery are. Since body image dissatisfaction is strongly related to lower self-esteem, thousands of people are looking for ways on how they can improve their looks. Among the reward, the most common ones are improvement of self-confidence, higher self-esteem, and improvement of psychological health. Plastic surgery also offers some risks that are important to mention as well. According to the article on aesthetic complications in plastic surgeries in today's times are far more than just cosmetic surgeries, since all surgeries can carry risk with no exception. From all plastic surgeries, bleeding and scars, plus addiction to plastic surgery, were the most common ones. Now you know why plastic surgery exists, and you can make a more educated decision if you ever consider this procedure. Today, I went through the history of plastic surgery and its development. I explained some of the most common treatments under demand, and also I informed you about some of the pros and cons that plastic surgery has on people. Lasting thought. It's obvious that appearance has always been important to people, since ancient times to present. Next time you want to improve your appearance, make sure you select wisely, either by using plastic surgery or natural resources. Thank you.